Here is exactly how the Home Health Aide evaluation works and how to pass it in just a few minutes. First, the framing that makes everything else make sense. There is no single national HHA exam. What exists is a federal rule, and every state and agency builds their evaluation on top of it. That rule is Title 42 of the Code of Federal Regulations, Section 484.80. The rule sets your training first, at least 75 hours total. And the order matters. A minimum of 16 hours of classroom training must come before a minimum of 16 hours of supervised practical training. You cannot start hands-on until the classroom hours are done. Then comes the part people are most surprised by. Your evaluation must be performed by a registered nurse. Not a coordinator, not an online proctor. A registered nurse in consultation with other skilled professionals where appropriate. And here is the single most important thing in this video. For some subjects, a written test is not allowed to be the whole evaluation. The rule requires that you be observed performing the task on a real person or a stand-in patient while the nurse watches. Which subjects? Communication skills, reading and recording vital signs, personal hygiene and grooming techniques, safe transfer methods, and normal range of motion and positioning. So no amount of studying alone finishes this credential. You can ace every written question and still not be certified because those 5 areas have to be demonstrated with your hands in front of a nurse. The written side covers 14 required subject areas in total. Communication and documentation, infection control, how the body works, keeping the home safe, emergency procedures, dignity and client needs, hygiene, transfers and walking, range of motion, nutrition and fluids, watching for skin changes, and anything else your state allows an aide to do. One more rule worth knowing before you are ever asked about it. Once you are working, you must receive at least 12 hours of in-service training in every 12-month period. That one can happen while you are caring for a client, but it does have to happen. 3 real questions. First, you have filled the basin for a client's complete bed bath. What do you do before any washing starts? Test the water temperature around 105 degrees, comfortably warm, and have the client confirm it feels right to them. Older skin burns faster, and the client's own judgment is part of the check. Second, what is the single most effective thing you can do to stop infections spreading in a client's home? Hand hygiene, before and after every single client contact. Not gloves instead of washing. Washing. It is the highest yield habit in the entire job. Third, the agency gives a patient written notice of their rights during the initial evaluation visit. If the patient has chosen a representative, when must that representative get the notice? Within 4 business days of that initial visit. Client rights come with actual deadlines, and they are testable. So how do you prepare? 4 habits. First, practice the 5 observed skills out loud and with your hands, not just on paper. Say each step as you do it, the way you will on evaluation day. Those 5 are where the credential is actually won. Second, learn client rights as rules with specifics. Privacy, choice, dignity, and who must be told what and by when. These feel soft, and then the question asks for a number. Third, drill safety and emergencies in the home setting, because home is not a hospital. Fall hazards, fire exits, what you do before you move someone, and when you stop and call for help instead of handling it yourself. Fourth, remember your scope. A huge share of test questions come down to one judgment. Is this task mine to do, or do I report it and wait? When something has changed about the client, observing and reporting it is almost always the correct answer. So remember, no single national exam, but one federal rule underneath all of them. 75 hours of training, with 16 classroom hours before 16 practical ones. A registered nurse evaluates you. 5 skills must be demonstrated on a person, not written, and 12 hours of in-service every year after that. Start now with free HHA practice questions at .com/en/HHA free, in English, Chinese, and Spanish, with no sign-up.